So last class we have finished with the conversation about the muscles of the facial expression, and today we're going to finish with the muscles of the head, and we're going to talk about muscles of mastication. Okay, so mastication means muscles that move the jaw. Masseter muscle, which you can see on this image right here, and the Bertie's head shows it here, inferior, deep to the parotid salivary gland. It's going to be number 13, something like that. Okay, that's masseter. The function of the masseter to close your mouth, elevate the mandible. Okay, it pretty much originates the zygomatic and maxillary bone and attaches to the mandible. Does that make sense? So upper jaw and the cheek and attaches to the mandible. Temporalis, large muscle which originates at the temporal bone. On Bertie, it is number 1. Is a synergist in the elevation of the mandible. So it's from temporalis to the mandible. And it helps to move the mandible sort of in the horizontal, in the transverse plane, which means retraction and side-to-side movements. Because you have 2 temporalis muscles, right? Okay. So essentially all those movements in the transverse plane, whether it's a retraction, protraction, or lateral movements, are necessary for grinding the food. Depression and elevation of the mandible is biting off. Grinding is lateral, and protraction, retraction movements. 2 pterygoid muscles. You can see them here. So lateral and medial pterygoid muscles. They are synergists in the elevation, protraction, and lateral movements. Okay? So they connect deep bones of the skull, such as the sphenoid, maxillary, and palatine bone, to the mandible. Now the last chewing muscle, mastication muscle, is buccinator. We've already mentioned it. Here, it is shown in the previous slides and the previous pictures. You couldn't really appreciate the location of buccinator because it's a muscle of a second layer. But here you can see it quite clearly. It extends from the maxilla and mandible to the orbicularis oris. Again, Bertie has buccinator hidden. It's muscle number 11 right here. It's a deep muscle of a cheek. Does that make sense? Now, muscles of the tongue. Tongue is actually the strongest muscle of your body itself. Well, all those muscles actually, they form the tongue. So all 3 of them together, if you will normalize the force they can produce to their weight, they are the strongest muscles. There are 3 glossus muscles that we're going to be talking about. Genioglossus is the tongue muscle which origin is at the mandible. Hyoglossus, which origin at the hyoid bone. You can see large, very large muscle. Okay. Obviously, if you contract it, it will depress the tongue. If you will contract genioglossus, it's going to be protrusion and depression. And styloglossus, which is the rather small muscle. Let me raise it here. You can see styloglossus here. Styloglossus originates from the styloid process of the temporal bone. You kind of can see it on bird. It's muscle number 21. Okay? So styloglossus um, 21. It's on the left side, yes. Styloglossus will be responsible mostly for the retraction, pulling the tongue back, and elevating the tongue up. Actually, we don't talk a lot here about mastication. We talk about process of mastication itself more in AP2, in the digestive system. But tongue, together with teeth, they are two main organs, two main structures in the mouth that are responsible for forming the bolus of food. That little sphere that you swallow eventually. Does that make sense? Go ahead. It's right here. It may be, maybe the numbers sometimes on birdie, the numbers may be erased. They don't always show up. Sure. Now, muscles of the neck and vertebral column. Before we talk about individual muscles, what I want you to understand is that there are several major movements that they do. With the neck, it's a rotation, correct? Left, right. It's the lateral flexion and forward and back, forward flexion, backward extension. Same goes for vertebral column. It's rotation of vertebral column, it's lateral flexion, and it's flexion and extension. So those muscles of the neck, muscles in your back, and muscles of the abdomen, they are responsible for those movements. The first muscle that we're going to mention is sternocleidomastoid muscle. It kind of explains, the name has the origin and the insertion. It originates at the sternum and the clavicle, so sterno. And it inserts into the mastoid process of the temporal bone. Sorry. You can see it very clearly. This, on birdie, is the large sternocleidomastoid muscle. On the other side, it has number 19. Okay? Does that make sense? The large muscle. Oh, yeah, that is totally wrong. Function is just totally wrong. Okay? That's just completely wrong. I copied the entire table and forgot to put the function. So sternocleidomastoid will be responsible for the rotation and extension of the head. Does that make sense? Let me write it down. And check, I may have, no. Okay, good. Rotation and extension of the head. So when you rotate, think about this. You contract this muscle, okay? And you're going to turn the head to the opposite side. And it will be also, the part of it will be working towards extension of the head, or hyperextension of the head. Does that make sense? Good. Scalenes. There are three scalene questions. There are three scalene muscles, middle, anterior, and posterior scalene. They originate at the vertebrae and inserted into the first and second ribs. Let me see, I don't remember if we can see them. We can't really see them quite clearly here. No, not really. Not on Bertie. What about Arnold? You can kind of appreciate scalenes. No, you can't. They're too deep. No, you can't really appreciate scalenes on Bertie, on Arnold. But pretty much, if you think about this, if you shorten these muscles, it will rotate the head, right, to the opposite side. Does that make sense? They will also be responsible for the lateral flexion of the head. Splenius muscles, shown here. Splenius capitis and splenius cervicus. They originate pretty much in the vertebral column. So, last cervical vertebrae and first 6 thoracic vertebrae. Ligamentum nuchae is the long ligament that runs along the vertebral column. So consider it, they originate in the vertebral column, upper thoracic portion. And they are attached to the temporal and occipital bone. Let me see if I can see splenius. Yeah. So 22 is the splenius capitis. I think it's 22. Yeah, it is 22. Right here. That's splenius capitis. So what it does, if you think about this, splenius capitis pretty much connects the skull to the vertebrae. And when you contract this muscle, that will be head extension. Does that make sense? You're just pulling it. Go ahead.
So that connects here to here.
Mm-hmm.
The scalenes, are they going forward toward the rib, or are they going?
They're going forward. So they originate at the vertebral column and inserted in the first 2 ribs. Okay? Does that make sense?
Yes, I was trying to picture it because it looks like they're coming back.
So let's say that's going to be extension. That's going to be rotation and flexion. Okay? Interesting thing about these muscles, the neck muscles. There are studies, for those of you who play contact sports, see like the entire room of people who play contact sports, especially American football. Strong neck muscles were shown to reduce the risk of concussion. So many, if you would look at, players, American football players, they have a neck that is size of like 2 of my thighs together. Okay, that actually helps to stabilize the head and partially, not prevent, but decrease the rate of concussion. Does that make sense?
There's an old boxing coach. I think he passed away like the other year. I haven't been down there in a while, but like around third grade, he had been like coaching boxing since before I was born, and I went with him for a while, a few years back, and him and my wrestling coach, they would say that for the longest, but I never heard anything about that. I guess until recent times.
Yeah, there were studies.
The less you get dazed when you take a hit, that's what he would call it. But
Yeah, because of the lesser whiplash effect. Now these are generally, these muscles, all of them, are called extensor spinae. Okay? So it loosely defines their function. They extend the vertebral column. They not only extend, they do way more than just extension. So, iliocostalis muscle, the lateralmost muscle here. There are several parts. Now, think about this. This whole muscle, iliocostalis, it's one muscle, okay? Don't even look at Arnold. He doesn't have them, okay? Well, he kind of does. 62 iliocostalis right here. Okay. But the point is, iliocostalis muscle has three compartments: cervicis, thoracis, and lumborum. So it tells you which ribs and which vertebrae are origin and insertion respectively. Cervicis, which is neck, okay? Insertion is cervical vertebrae. The origin are the upper ribs. Thoracis, origin is lower ribs, and insertion, transverse process of C7 vertebrae, somewhere like here. And lumborum is the iliac crest right here and the lumbar fascia. You can see lumbar fascia on this dude right here. Okay? The insertion, the lower ribs. So if you think about this, what happens? Cervicis originates in the lower ribs. Insertion is lower cervical vertebrae. Thoracis originates in the last 6 ribs. Insertion are sort of the first 6 ribs. Lumborum originates in the lumbar region. Insertion is the last 6 ribs. So I don't know how to explain. Each lower portion inserts in the upper portion. Does that make sense? So they kind of step by step. Where upper portion originates, lower portion inserts. What it does, it extends your spine. It also assists in the lateral flexion of it. Okay? Again, on this image I want to highlight it for you. This is that outermost muscle. Those different compartments, they fused. It's like one long, very long muscle. Longissimus muscle. Next one. So iliocostalis is the lateralmost. Next one is this long longissimus muscle. It has 3 parts: capitis, which refers to the head; cervicis, which refers to the neck; and thoracis, which refers to the thoracic portion. They all originate at the transverse processes of vertebrae. So if you would look at the vertebral column that are hanging, that is hanging right there, the transverse processes that go in, to the sides, that's where this muscle originates. Insertions of the capitis portion is the mastoid process. So it inserts, you can see it on the dude, but it inserts right here. It's a deep muscle. That's mastoid process. So the main function of longissimus capitis is the head extension. Also, since, now think about this, that's actually pretty cool. Sternocleidomastoid. Its origin is at the sternum, insertion at the mastoid process. When you pull on it, the head turns to the opposite side. I pull on the left sternocleidomastoid, my head turns to the right. Does that make sense? Here, the origin is not on the anterior aspect of the trunk, but on the posterior one. So if you pull on this muscle, so you pull here, you pull in the back, then if I pull on the left longissimus muscle, my head will turn to the left. Do you see the mechanical difference between the two? Okay, this is mastoid process right here. This is hypothetically my right arm here is sternocleidomastoid. My left arm here is longissimus. When I pull on sternocleidomastoid, where does my head turn?
The sternocleidomastoid is attached.
Here, sternum. Here. Do you see why? Do you see why? Okay. Now, if I pull back, to the back side, it turns to the same side. So my left longissimus capitis will turn the head to the left side. My left sternocleidomastoid will turn the head to the right side. Okay? Cervicis and thoracis portions, since they have insertions into the transverse processes of the vertebrae, will be responsible for extension and, that is important, lateral flexion of the vertebral column. Now think about this. Let me erase it. Look at the origin of longissimus capitis, cervical vertebrae, right? Look at the origin of longissimus cervicis, cervical vertebrae. Look at the origin of longissimus cervicus, thoracic vertebrae. Look at the insertion of longissimus thoracis, thoracic vertebra. What I'm trying to say is that in this case also the lower part of the muscle has the insertion where upper part of the muscle originates. So they go like this. If my fingers are insertion, they go like this. So when you pull on those muscles, especially cervicis and thoracic part, they can do either this or they can do this. Are we good about that? Quadratus lumborum, pretty large muscle that stabilizes your vertebral column. Okay? Its origin is the iliocrest. Let me see if we can. No, not on this guy. The insertion is 12th rib. The direction is wrong on that guy. Insertion is 12th rib and transverse processes of the lumbar vertebrae. Now, this muscle, if you pull on it, it's lateral flexion. Okay? Mostly. Now, think about this. Look at the size of the muscles such as iliocostalis or longissimus. Are they wide? They aren't. However, quadratus lumborum is pretty wide and massive. From the mechanical standpoint, can you explain why? Not only supports, what type of lever quadratus lumborum works with? Is that mechanical advantage or mechanical disadvantage? Where's the fulcrum for lateral flexion of the vertebrae, vertebral column? Where's the fulcrum? Well, somewhere in the bottom, yeah. somewhere down, you know, in the lumbar vertebrae. Think about this. Look at me. This is the fulcrum, right? Lower part of the vertebral column. Where's the effort for quadratus lumborum? Where does it apply effort? Which vertebrae? Huh? No. Those are lumbar vertebrae, right? That's where it applies effort. Where's the load? What is the load for lateral flexion? Yeah, the entire trunk. Does that make sense? So the distance between the fulcrum to the load is much longer than the distance between the effort and the load. By definition, it's the lever that operates with mechanical disadvantage. Now, lever that operates with mechanical disadvantage. Can you use that lever to move large weight? No, you can't. What do you use it for? Fast movements. So if I throw something at you, you can duck, you know, you can move out of the way. Does that make sense? Got it? Semispinalis. Muscles getting smaller and smaller. So this is semispinalis. There are several regions: capitis, cervicis, and thoracis. Okay. So this is extension and head rotation. It's interesting because these muscles, they connect transverse processes to the spinous processes. So they act in much more refined way to regulate the extension of the vertebral column. So they all originated the transverse processes starting from the last cervical vertebrae, and they go upper portion of thoracic, cervicis and capitis, and lower portion of thoracic vertebrae. They started the transverse, and they insert in the spinous process of the compartment above. Semispinalis capitis inserts into the occipital bone. So think about this. If the muscle starts at the transverse processes of the vertebrae and inserts in the occipital bone, when you contract it, it's going to be extension of the head. Does that make sense? If it starts at the transverse processes of the lower compartment of the vertebral column and inserts into the spinous process of the superior compartment, let's try to show it here. So this is thoracis, okay? It starts at the lower thoracic compartment and inserted in the upper thoracic compartment. It is fine extension of the vertebral column. And finally, spinalis muscles. You can see them right here. They run exactly along the spine. So in our description, we went from iliocostalis to longissimus to semispinalis to spinalis. Okay? From iliocostalis through longissimus to the semispinalis to the spinalis. Spinalis is the muscle that runs exactly along the vertebral column. Okay? Origin are spinous processes. Insertion are spinous processes. And again, origin is the lower compartment, insertion is the upper compartment. Origin is the lower cervical, upper thoracic. Insertion is very much upper cervical. You can see that those muscles are pretty small. Can you see that? Can you appreciate that? These muscles are small. They're definitely not powerful. Although we say that they play an important role in the extension and lateral flexion of vertebral column, what is essentially their main function? So fine that you can't really see those movements. What do they do? Those muscles. What do they maintain? Posture. They maintain your back straight up. And as I mentioned before, and I want to mention now, when your mom says, oh, don't write like this, you're going to be, you know, the hunchback. No, you're not going to be a hunchback. You can write in any position you want. If you have strong back muscles, you're going to walk upright. Okay, and that's actually one of the most important things. Does that make sense? Muscles of breathing. Diaphragm. Surface of the rib cage. Insertion is so-called central tendon. Okay? When diaphragm contracts, it goes down. The volume of your thoracic cage increases. Your lungs inflate. You breathe in. Okay? When obviously it relaxes, it moves up and pushes the air out of the lungs. Internal intercostals. Origin is superior border of the lower rib. Rib insertion is the inferior border of the upper rib. Think about them as two layers of muscles. Okay? Internal intercostals depresses the rib cage and helps you to forcefully expire. External intercostals, which have origin at the rib above and insertion at the rib below, help you to inspire by elevating the rib cage. Which muscle is more important for breathing? The most important for breathing out of these three? Exactly, the diaphragm. If you have some kind of calcification of the cartilage, or your intercostals are paralyzed, for instance, if diaphragm is still working, you're going to be able to breathe. If it doesn't, you toast. We good? They superficial to them. Does that make sense? Four muscles of abdominal wall. Arnold will really help me on that. If you want to grab it, the Arnolds, there are 1, 2, 3, 4. Well, there are plenty of Arnolds right there. At least 4 sitting down there. So what I'm going to do, I'm going to disassemble this dude as I talk about the muscles. So muscles of the abdominal wall are organized in 3 layers. Okay? The first muscle, actually, I kind of didn't arrange them good enough. Okay, the first one we're going to talk about is rectus abdominis. Rectus abdominis is the great example of muscle naming. Rectus means straight. Yep. Rectus means straight, and as Mark correctly pointed, not just straight, vertical straight. Okay? So rectus abdominis is infamous six-pack. Okay? Make sense? That's six-pack. Rectus abdominis. It is actually muscle of the second layer. Here on Arnold, it has number 56. Its origin is at the pubis, pubic crest and symphysis, right here. Okay? It inserts into the xiphoid process and 5th and 7th costal cartilages. And what's going to happen to you if you shorten this muscle? You're going to bow. Okay? So it's going to be flexion of the trunk. Does that make sense? External oblique. Oblique means angle, diagonal. External oblique is the most superficial abdominal muscle. On Arnold, you can see it under number 55. Okay? And originates at the ribs 5 through 12 right here, and it inserts via the tendon into the iliocrest and pubis. This tendon, okay, you can call it, so this linea in the center is called linea alba. This large aponeurosis is often called rectus sheath. Okay? Now, if you think about what happens when you use this muscle, lateral flexion, rotation, okay, and also very importantly, compression of abdominal wall. Why do you need to compress abdominal wall? If things are falling out of your abdominal wall, the external oblique is not going to happen. You probably just got it. Why do you need to compress abdominal wall? Pooping, peeing. Okay? This is also called Valsalva's maneuver. When you increase the pressure in the abdominal cavity to push, intestinal content out. Does that make sense? Actually, all 4 muscles participate in it. Don't get me wrong. Everything does it. Okay? Internal oblique are at the same level as the rectus abdominis. Internal oblique have number 57 on Arnold. They run at a different angle. In this image, you can see internal obliques right here. You see internal oblique. Okay? The origin is in the lumbar fascia, iliocrest, and inguinum. And the insertion is rectus sheath and via tendons, pubic crest. They also do rotation, lateral flexion, forward flexion. And the 4th muscle is Transversus abdominis. If you remove the anterior portion of Arnold, you can see Transversus abdominis running inside to the number of 143. Its main function is the compression of abdominal content. Originates the lumbar fascia, which means the back. You can't see it because it's deep, okay? So it originates at the lumbar fascia, okay, and has insertion at the linea alba, or rectus sheath, call it whatever you want, and pubic crest. So they all pretty much, oblique and transverse muscles, they all insert into the rectus sheath and the pubic crest. And they originate at the iliocrest and some of them in the lumbar fascia. Now, a little bit more about organization. I want to go over it again with you. Layer by layer, the outermost layer of the abdominal muscles is comprised by the external obliques and the aponeurosis that we call rectus sheath. On this image here, you can see external oblique being the superficial muscles of the abdominal wall. Abdominal rectus or rectus abdominis, together with internal obliques, make the second layer. Here you can see the second layer, okay? That rectus abdominis, that's internal oblique. And then the third layer is transversus abdominis. Does that make sense? The layer organization. Now, another feature for those of you who exercises. What do you think is one of the most effective exercises for abdominal wall? Deadlift. When you do deadlift, to stabilize your trunk, you increase the pressure in the abdominal cavity. I mean, by deadlift, I'm not going to, like this. It's not a deadlift. Come on. Okay? I'm talking about some weight. Okay? So when you do deadlift, you increase the pressure in the abdominal cavity to stabilize your trunk so you don't bend forward or backward. That stabilization is achieved by two ways. First, your abdominal muscles contract and increase the pressure in the abdominal cavity. What happens when you increase the pressure in the abdominal cavity? Can happen. I hope it doesn't, but can. Hopefully not, but yes, it can happen. Sorry for the details, but I spoke to a person who attended the weightlifting championships, even local. When those fellas lift the weights, it's like Ypres in 1916 behind them. You need to wear a gas mask. All the gases, all the intestinal gases are being pushed out because of that enormous abdominal pressure. What happens to the diaphragm? When pressure in the abdomen increases, where does the diaphragm go? It should go up, and it should push the air out of the lungs. But here's the little trick. You have vocal cords right here. And when you silent, vocal cords are closed, and they prevent air from getting out of your lungs. Those closed vocal cords allow you to keep pressure in the abdominal cavity. So when you elevate the pressure by contracting the abdominal muscles, this is called Valsalva's maneuver that I already mentioned, and it's really effective in stabilizing your trunk. If you want to see if it works or not, next time you do the deadlift, ask your friend to show you something funny. If you will laugh, you will immediately drop the weight. Because stabilization will go away, you won't be able to hold it. Does that make sense? So deadlift is one of the most effective exercises for the strength of the abdominal muscles. Anything that stabilizes the trunk, plank, that's all stabilization of the trunk. Okay? Muscles of the pelvic floor. Okay, there are two muscles, levator ani, which is pretty big muscle that originates, in pubis to the ischial spine, that all line here, okay, and it inserts into the inner surface of coccyx. You can see it here. Coccygeus, ischial spine. You can see coccygeus muscle right here. Okay, so that's coccygeal spine. This is coccyx. inserts into coccyx. The function, just maintenance of pelvic organs, they also very important for forceful urination. Okay, when they contract, they push in the urinary bladder and you urinate, and they're important for childbirth. Pregnant women often have problems with incontinence. Not only when they carry the fetus, it's obvious, it's a large mass that presses on the urinary bladder, so urine is constantly being pushed out. But often, even after the birth, problems with incontinence may persist for several months. The reason for that, those muscles weaken. They will go back to normal, but for some time they weaken, and they can't really either push the urine out or hold it. They have a problem with that. Muscles of the trunk, superficial muscles of the trunk. Pectoralis minor, small muscle, you can see it here, number 52 on Arnold. They originate at the ribs and insert into the scapula. Okay? So this is what they do. This is pectoralis minor. It's a small muscle of the fine movements. Okay, they draw scapula forward. Serratus anterior originates in the ribs from 1 to 9. You can see them here. And they are inserted into the vertebral border of the scapula. Vertebral border of the scapula, it refers to that medial border. Right here. You can see it. They insert it deep. Okay? Oh, yeah. Here they are. They insert it here. Okay? Rotates scapula and abducts the arm. Okay? Serratus anterior are extremely important for proper pushing. Subclavius is a very small muscle right here. That pretty much connects the first rib with the clavicle. The role is to stabilize pectoral girdle. Every movement that is done at the pectoral girdle, every arm movement requires the girdle stabilization. So subclavius always participates. It's not a muscle that produces huge effort, but it's extremely important for proper movement. Posterior muscles, trapezius. It's a huge muscle right here, number 34. That's the muscle, okay? So it's more of a triangle, but if you take two, it'll look a little bit like trapezius. So the origin is wrong. Okay? The origin of trapezius are, what's the word? Spinous processes of the vertebrae. And the insertion is the spine of scapula. Okay, and it elevates pectoral girdle, elevates the shoulders. Does that make sense? Levator scapulae, right here, originates at the transverse processes of the first cervical vertebrae. It has an insertion into the medial border of the scapula, and its function so let's write it down. The function of levator scapulae is to elevate scapula. And the third muscle is rhomboid. There are two rhomboids, minor and major. You can see rhomboid major and rhomboid minor. So major and minor. The Arnold, you can see major under the number of 59 right here. Go ahead. No. Sure, no. It's not a dumb question. It's actually a great idea. Yeah. Absolutely. So that's rhomboid major better. That's rhomboid minor. This is trapezius. Oh, trapezius, what it also does, it moves the scapula medially and posteriorly. It does this. Does that make sense? So it elevates the scapula and medially and posteriorly moves the scapula. Okay. Rhomboid also brings the scapula together like this. So it's an effort from both trapezius and rhomboid. So let's write it down. Scapular movement, posterior, medial, shoulder elevation, and scapular movement, posterior, medial. Does that make sense? You can see that all of these muscles originate in the vertebral column. Different regions, like rhomboid major originates from the spinous processes of the thoracic vertebrae. Okay? Now, these muscles, pectoralis major, latissimus dorsi, and humerus, are the prime movers of the arm. They're responsible for the flexion, abduction of the extension in the shoulder joint. Pectoralis major, the big chest muscle, okay? Origin is at the clavicle and sternum. Insertion is in the humerus. You can't see the insertion because it's kind of hidden. The insertion is going to be in the humerus. So when you contract this muscle, the main function is flexion of the shoulder. This. Does that make sense? Flexion of the shoulder. That's pectoralis major. Not elbows, shoulder. Lifting something with your extended arms. Okay? So essentially, one of the exercises for the chest muscles is this, right? Flies. This is flexion. It's flexion not in the mid-sagittal plane, it's a flexion in the transverse plane. Latissimus dorsi, largest muscle in the human body. Origin mainly vertebrae, ribs, even iliocrest, so it has multiple origins, and insertion is in the humerus. Now that's kind of interesting because if you think about this, that's enormously strong muscle, that acts with an enormous mechanical disadvantage because it moves the entire arm, while the lever, the distance between the effort and the fulcrum is very short. Does that make sense? So the main function is the extension and abduction of the arm. And if you think about people who have the most developed latissimus dorsi and pectoralis muscles, swimmers. Because those arm movements during the freestyle swim, it's the combination of extension, flexion, abduction, and adduction. So they do like combination of extension, flexion, abduction, adduction, circumduction when they do this movement. Does that make sense? Deltoid muscle, shoulder muscle. The origin is at the clavicle and scapula. The insertion is in the humerus. So what it does, it extends the muscle, extends the arm, and abducts the arm. Okay? Now these 7 muscles are also called rotator cuff muscles. These are the muscles that stabilize the shoulder joint and adduct the arm. A lot of them do. So subscapularis, those are probably the easiest to find and to name. Subscapularis, infraspinatus, supraspinatus. Let me go up for a second and show. So that subscapularis, can you see it here? Is located in the subscapular fossa, the anterior subscapular fossa of the scapula. Let me see if I have. I don't have bones here, so I can't really show you. But if you would look at Marvin right there, and if you would look behind the rib cage and you would look at the scapula, that large shallow depression, anterior depression of the scapula, that's subscapular fossa. That's where subscapularis muscle is. Rotates the humerus. Okay, this. Supraspinatus and infraspinatus. Supraspinatus is located in supraspinous fossa. Infraspinatus is located in infraspinous fossa. Okay. Supraspinatus is the synergist in abduction, which makes perfect sense. If you contract this, the humerus will go up. Okay. Infraspinatus will rotate the humerus laterally. You pull on this muscle, humerus rotates laterally. Teres major and minor. So this is the teres major, this is the teres minor. Teres minor plays main role in the lateral rotation. Teres major is the main adductor of an arm. Does that make sense? Finally, Coracobrachialis. Let me see if I can. Yeah, there we go. So Coracobrachialis, from coracoid process of scapula to the medial shaft of the humerus. If you will contract this muscle, you will bring your arms to the body. So it's one of the arm adductors. Actually, from the standpoint of day-to-day life, the main function of these 7 muscles is not so much to, you don't rotate the humerus like every second of your life, you don't do this every second of your life. The main function of those muscles is to stabilize the shoulder joint. Okay? That makes sense? muscles of the forearm. We're going to start with extensors. Now these muscles, extensors and the flexors of the forearm, they cross the shoulder joint. So only two movements, well, two main movements at the shoulder joint, which is hinge joint, the flexion and extension. Correct? Triceps brachii, posterior muscle of the upper arm. It has origin at the humerus and scapula. Okay, so you can see the head that originates at the humerus, and the head, it will right there, originates at scapula. This head will originate at scapula. And it is inserted into the olecranon of ulna. It is inserted here in the ulna. Okay, actually, no, let's do this. We have, yeah. We'll finish extensors and flexors, and then we will take a break, and during the break I will pull out those muscles of the leg and the arm, okay? It extends the forearm. That's it. However, think about this. Since triceps brachii is inserted, it originates at the scapula, and it is inserted in ulna, by contraction it can be a synergist of the adduction of an arm. Does that make sense? Anconeus is a tiny little muscle right here. Very, very small. This is the synergist of the extension of the forearm. Origin is at the humerus, insertion is in the olecranon of ulna. And, oh, by the way, you see that cross section of the upper arm? This entire muscle is triceps brachii. For gym aficionados, it is known that if somebody wants big upper arms, then it shouldn't be biceps that you should work on. It should be triceps. Because when they become bigger, when they hypertrophy, arm looks much more remarkable. Flexors of the forearm. Biceps brachii, brachialis, and brachioradialis. First of all, functionally, to summarize, two muscles are the primary flexors of the upper arm. Biceps brachii and brachialis. Biceps brachii has the origin at the scapula. Insertion, radius. Okay. Brachialis, right here, origin at the humerus, insertion is at the ulna. So what they do when they contract, they flex the arm. If you would look at this dude right here, you can see biceps very clearly. And then if you would turn him sideways, this muscle immediately deep to biceps brachii is brachialis. Those two are prime flexors. Brachioradialis, shown here, it originates at the distal humerus, okay? And the insertion is at the styloid process of radius. Now if you would look, I can't reach Marvin. Maybe. Dude. Thank you. So if you would look at Marvin, distal humerus is here. Styloid process of radius is right here. So you can see that to bend the elbow, it's a lousy position, really. Okay? It's really not a good position. So brachioradialis is the synergist, the forearm flexion, but it's not a primary mover. Does it make sense? We're going to pause it.